I'm a cardiologist, so I deal with all kinds of problems that relate to the heart, blood pressure, people who've had a previous heart attack, heart rhythm problems, heart failure. Those are the kind of things that we treat.
You're out of Vegas, but you're with healthcare partners there and at this location as well, which is the specialty clinic.
Correct. I do have 2 days of office in Las Vegas, but when I made this move to Healthcare Partners from my previous practice, the big advantage was that they offered me the opportunity to be here 3 days a week.
So you're actually at this location here in Pahrump 3 days a week?
I am.
Wonderful.
I am. I think it is wonderful.
You operate out of Desert View Hospital as well as Vegas hospitals too?
The group that I'm in has physicians that cover the Vegas hospitals. We actually don't do day-to-day coverage at the hospital here.
Are you a surgeon as well?
Well, if you define surgery as doing stents or pacemaker implants, yes, that's been part of my career too.
What's some of the biggest complaints or appointments that you see?
Well, people coming in for chest pressure, chest discomfort symptoms, shortness of breath symptoms, palpitations, people who are concerned about their risk of having a heart attack or who have a strong family history. They want to know what to do to decrease their risk. Or some people come in and they want to know if there are tests that can be done to look for heart disease, which we now offer right here in this clinic.
What's some advice that you can give to people to stay heart healthy?
There are really 4 or 5 things that, if done and done fairly well, dramatically reduce the risk of a heart attack or heart disease. Smoking cessation is really the number one and has the biggest impact. Managing the cholesterol levels, keeping the weight down, and being physically active at the same time, and treating high blood pressure and diabetes. If those things are done, 80% of what I see people for wouldn't exist.
Do they need a referral to come see a cardiologist going through their general practitioner, or can they call you directly?
It depends on their health plan and coverage. People with private insurance and Medicare typically can make an appointment. People on the health plan go through their primary. I like it when they're referred only because then I can coordinate their care, their testing, and the advice I give them through their primary care doctor, who really is going to help me tremendously in managing that person and giving them the advice and following through.
Should a patient have checkups with a cardiologist on a regular basis?
It depends on the condition. If they've got a significant cardiac condition, regular follow-up is really important. If they're just coming in for a risk assessment, or it's a question of I have a family history, do I have heart disease, sometimes just one appointment's sufficient.